I'm Reetu Mukherji. I'm a fellow at Georgetown University Hospital.
I'm Chao Yin. I'm Reetu's co-fellow at Georgetown.
We're reporting here from the Roof Center booth at the symposium. Chao, what has been your best part of this experience here this weekend?
I'd say probably meeting old colleagues again. It's been very social. It's been very overwhelming. First day spent 2 hours in registration. That just speaks on behalf of a number of people here, but it's very nice to see old faces again.
I think it's been great seeing some of our old fellows and learning about their research and what they've been doing, and then also meeting with some of our partners who are partnering within our studies, like our pharmaceutical companies, and it's been great networking here. What has been one of the, I guess, concepts or studies in GI that has been most interesting to you?
Honestly, so across, I think across all diseases, I mean, the studies have all been very impressive. I think rather than actually naming any particular abstract, I think some of the favorite talks that are a little bit different than what we typically hear are, I consider them talks about how to be a better doctor per se. Talks on ethics and things like equality, or equity of care and microaggression. So there's been several of those, and I think the speakers bring up very good topics and kind of food for thought on things that we don't really realize, like how saying something that or saying something saying something by mouth can have a lot of impacts on people that you're saying these things to, and it's just not. It's often things that we don't really think about. It's not always obvious.
Definitely.
What about you?
I think what you mentioned, a lot of discussion on equity and disparities in healthcare. It's good to see that more and more studies like this are coming out, and we're bringing more light to it. I think I've been interested a lot by a lot of the biomarker studies within GI cancers too, and then even outside of GI cancers, we're seeing more targeted therapies and studies incorporated in upper GI, biliary, and some interesting early data from incorporating immunotherapy and targeted therapies earlier in these cancers. And I think it was interesting, of course, in the plenary session to hear about using HER2 targeted therapy in breast cancers where there's less HER2 expression, and just the potential application of this in other tumor types as well, because we are seeing this being used in GI cancers as well. So I think a lot of interesting studies coming out and, kind of hypothesis provoking for bringing it to GI cancers.
Yeah, totally agree. Would you come back here?
I will come back here. I would love to come back here. Chicago's it's been great.
Yeah, no. One thing like I didn't mention is just seeing the city. It's my first time in Chicago. Have you been or?
I've been very
Yeah.
briefly, but nothing like this. So.
Yeah. Just seeing the city, kind of using it as an opportunity to see a new place, and with the good weather, the perfect time of the year, it just overall makes for a really good experience.
Very happy to be